So hi, hello everyone. Welcome back to my channel. So today I am with you giving a very best topic which is important also for the second year Pharm-D students. Still I am not considering it as I am doing a lesson or a particular chapter for second year. It is my duty to tell these common chapters for people where I can share the knowledge of knowing what all diseases can cause what all things in the people. It is like a general knowledge things which you have to know. So the topic I am discussing with you today is hyperlipidemia. So, what is hyperlipidemia? Hyperlipidemia is a condition where more amount of lipids or fat found in your blood. So, these lipids mainly include cholesterol and triglycerides, which are very important for the essential normal body function of a person. But if it is severe in case, it may lead to cardiovascular diseases like heart attacks, angina, etc. and also stroke. So, there are two types of hyperlipidemia. One is primary hyperlipidemia and one more is secondary hyperlipidemia. So, if I want to explain you what is primary hyperlipidemia and secondary hyperlipidemia, primary hyperlipidemia is nothing but it is caused due to genetic factor where the person will be facing high lipid metabolism, which is very much abnormal. But in secondary hyperlipidemia, the etiological factors are completely external. It is due to the result of obesity, kidney disease, if the person is consuming more alcohol, all these factors affect the secondary hyperlipidemia. Coming to the causes and the risk factors of hyperlipidemia, where first and foremost I have to discuss about genetics. If a person is having any family history of heart attacks or obesity or high cholesterol in any of his family, then yes, it would come along with in the genetics. And if the person is taking unhealthy diet like unsaturated or trans food more, then yes, it leads to hyperlipidemia. And also if the person is having obesity, of course it leads to hyperlipidemia. If the person is having a sedentary lifestyle where he does not do much workout for his body, but still he is intaking more amount of food which is not required, it leads to hyperlipidemia. And if the person is having any other medical conditions like hypothyroidism, kidney disease, liver disease, etc., it leads to hyperlipidemia. I am extremely sorry. And if the person is in medications or if a person is taking any drugs, it may lead to hyperlipidemia. For example, if the person is taking any diuretics or beta blockers, all these drugs is just a reason or a causative agent for hyperlipidemia. So till now we have discussed about the cause and the risk factor of hyperlipidemia. Now let us come to the symptoms of hyperlipidemia. So what are the symptoms of hyperlipidemia? Let me tell you. Hyperlipidemia is itself does not cause a symptom until and unless it goes to very severe case, because it is also known as a silent condition, where in the case like a very comorbid condition, you can see if a person is having any heart problems, cardiovascular diseases, if the person is taking drugs like diuretics or beta blockers, any other factors are affecting the person and it is causing hyperlipidemia, but hyperlipidemia itself doesn't cause any symptoms or any changes in the person. But let me explain you, if there is a hyperlipidemia, what are the symptoms? There will be fat deposition and chest pain, which is also called as angina, and also the person will face the symptoms of stroke, where there will be weakness, and slurred speech, where the speech will be very much variation. All these are the symptoms where the person is facing hyperlipidemia. So coming to the diagnosis part of our hyperlipidemia, where we are mainly gonna undergo with the lipid profile test or lipid panel test. So this test is mainly consists of total cholesterol amount and LDL, HDL. LDL is known as low density lipoproteins and HDL is high density lipoprotein, where we consider HDL is the good cholesterol where a particular human needs for his very healthy blood supply, and HDL also helps to avoid fat deposition in the particular person's body. So we refer to increase the HDL level in that particular person, and also triglycerides are also measured. After doing all these comparisons, a doctor will recommend you whether you are hyperlipidemic or hypo, or the person is normal. These are the diagnosis of the hyperlipidemia. So discussing about the complications of hyperlipidemia, firstly, I'm gonna tell you what is atherosclerosis, because it is also a kind of major cause people facing hyperlipidemia. Atherosclerosis is nothing but a fat deposition in the arteries, where it blocks the blood vessels and the tissue becomes deprived from the oxygen level, and finally it leads to the tissue death. So atherosclerosis is the main basic symptom for cause of hyperlipidemia. And coming to the next gradual stages, coronary artery diseases, where a person is having any hyperlipidemic conditions, then yes, the person is facing any of the heart diseases. Even if it is a very first stage, also the person would be facing angina, where it is also called as chest pain, and even more severe cases we can expect it as a stroke, all these things. So these are the complications of hyperlipidemia. So coming to the lifestyle management, if a person is having hyperlipidemia, then the person should intake more healthy diet, where it should include all the fibrous items and all the fruits, vegetables, leaves, lettuce, grains, sprouts, everything. A healthy diet improves your blood and improves your HDL level, all these things. And regular exercise must, recommended one. Walking, brisk walking especially, yes, of course, mostly recommended for people who is having obesity and hyperlipidemia. And if a person is a smoker or an alcoholic, it should be avoided. I know it is very difficult to stop all of a sudden, and it should not be stopped all of a sudden. If the person is having any withdrawal syndrome due to the stop of that addiction, he may get hospitalized. So better to reduce the intake. If the person is taking alcohol every day, take it weekly once or twice, then reduce it to monthly once or twice. You should implement all these things in your daily lifestyle. This is the major thing that I am recommending for a very healthy lifestyle, the person who is having hyperlipidemia. So let me conclude this video with a short sentence, where I can only tell you people that hyperlipidemia mostly requires the change in your lifestyle. Yes, because medical treatments will be given if any serious conditions are there, but in your lifestyles, in your diet, in your healthy food intake, you can overcome hyperlipidemia. So I request, if anyone is facing all these things, go check yourself. Doesn't matter, but it is not if you are in a beginning stage or anything, it is not compulsory to take the medications if you are in the beginning stage. So please take a very healthy diet and start exercising. If you're alcoholic, chhod do, wait, you have to sacrifice something to gain your health, because health is wealth. If you are healthy, you can do miracles in your lives. So please don't destroy that. It is mostly recommended for people who is taking smoke, alcohol every day, every week. Avoid it. I have seen many people taking it daily. It is very bad to tell it in this way. As a doctor, it is my responsibility to recommend people to avoid all these things. And concluding this video, if you are new to my channel, please don't forget to like, share and subscribe. It's my pleasure to do the cases which I am handling. Nowadays, yes, there are many cases in the hospital where I have seen people with COPD, hypertension, type 2 diabetes, etc, etc, etc. And also recently I have gone with the malignancy of tongue, where the person was detected by squamous cell carcinoma. My next topic will be that. And it is really exciting. It is the department of ENT. It was a very special case which I was handling personally. So I feel happy to discuss with you people. And that's all. Thank you so much for supporting all these days. If you are new to my channel, please don't forget to subscribe, like, share, and thank you.